Hey, future respiratory therapist. First of all, good morning. Happy hump day. I woke up today with some thoughts on my mind, but before I share those with you, I wanna share what I woke up with on my heart today. And you may notice my Weatherford Respiratory shirt. This is a shirt that belongs to the Weatherford Respiratory Care program, a program that's dear to my heart. And I woke up thinking about them this morning because, there's respiratory therapy students all over this country that are on Christmas break right now, and you're all sleeping in late and enjoying your family and your friends, having a good time, and you should be doing that. But it's not like that for everybody. And so I wanted to give Weatherford a shout out today because tragedy struck that program at the most inopportune time, which is really a tragedy like this is any time. But in the middle of finals of all times, tragedy struck that program, and my heart goes out to them. As students and faculty members in these health science programs, you kind of become a little family. You become close to your classmates, and you become, in some cases, close to your instructors, and these people become important to you while you're on this journey together. And just like any family, tragedy can strike at any time, and that's unfortunately happened to the Weatherford Respiratory Care program. So I just want them to know that my thoughts and prayers are with them. The community as a whole, the respiratory community as a whole, should be with them during this time, because it impacts much beyond just the direct family, but the extended family, your school family, your school faculty. Everybody's impacted, and so this isn't a joyous time for all. So please keep Weatherford in your thoughts as you enjoy your Christmas break. Now, I told you that I woke up with some thoughts on my mind this morning, and I just want to share them with you, because what I've realized is as future respiratory therapists, you're going to get a lot of advice along the way. And I want you to be aware that not all advice is good advice. There is going to be times when you're going to get bad advice, and that's really what I want to share with you today. And I want to show you something that stood out to me as I woke up this morning. I was thinking, I said, there's one thing in common with this concept of advice. And so I'm going to share with you 4 examples of advice I got early on in my career, and then just briefly talk about them, and then we'll wrap this up. So very early, I was a new grad. I was working in an ICU, and I was working alongside a veteran respiratory therapist. She was very smart. She was very good with her patients. And she came to me and she said, "Joe, you work really hard. And I want to tell you something." And she said it just like this. She said, "Let me give you some advice. Never let anyone know exactly how much you know and exactly how hard you will work, because they will take advantage of you. And you will be asked to do more, and more will be asked of you." And at the time, I thought to myself, this is fantastic advice. This is genius. Why didn't I think of this before? Well, the answer to that is because that advice goes against human nature. You see, that advice says, just come in here and do very little. Don't let them know what your potential is, and just do your job and be quiet and get your paycheck and go home. And that's average. That is average. It's so easy to be average in healthcare. And that's not okay when we're dealing with people and humans. Your goal should be to, wherever you are now, should be to improve, and to improve yourself to eventually lead to better patient care, so that you provide better for your patients, not average, not I'm not going to excel in anything because I don't want to be asked more of me. Okay, that was the first piece of advice that I got early on that I later realized was terrible advice. Now, the next piece of advice came when I was in a contentious disagreement, or you really wouldn't call it an argument, but there was a patient safety issue going on, and I was involved with a very contentious discussion with the physician that how we were going to treat this patient and where they needed to be taken care of. And it got very, very ugly, and I eventually got called to my manager's room, to my manager's office, and my manager told me this: Joe, let me give you some advice. Learn to duck and just go with the physician. And that's bad advice. You see, there's safety procedures and protocols in place to benefit the patient. And this physician supremacy mindset that sometimes says, I don't care what the protocols are, I don't care what the procedures, I don't care the policy, do it this way, is not a time to duck. Okay, that's not the time to say, okay, I'm just going to duck and go with whatever you say. Now that wasn't good advice in that context. Now, when I think about it in a different context, it actually is good advice, because the last thing you want to do when you're throwing punches with somebody is to throw back, because that's never going to lead to a positive outcome. So learning to duck can actually be good advice if it's in the context of learn to duck and be smarter with your approach to the battle. Okay? So while in that context it wasn't good advice, different perspective on it can actually turn it around and say, you know what, that wasn't bad advice. Now, the last piece of advice I received was from a fellow coworker that was not too long ago in recent years, and it basically evolved around a meeting and being a part of these department meetings that sometimes, as either some of you know or some of you are about to find out, they can be long and mundane and not a lot comes out of them sometimes. But the person told me this. They said, Joe, let me give you some advice. These meetings will be much shorter if you'll stop asking questions. Now, obviously, that's terrible advice. Because you see, when you're asking questions, then you're gaining information. And you're gaining insight into the process at play. And sometimes the process at play needs to be improved upon. And I say sometimes, but typically all the time, the process at play has some area where improvement can happen. So don't ever pipe down because others are ready to get out of there because they don't want the meeting to last too long. Okay? Anytime you're in search of information, then go get the knowledge that you're searching for. And if that comes out of a meeting, and the meeting runs an hour and 15 minutes instead of 50 minutes, then the meeting runs long. But you're on a mission to improve the process. And so don't not ask questions because somebody cares about the meeting being over quicker so they can get to the golf course or whatever it is that they need to get to. That's not what it's about. And honestly, what you're going to find yourself in some cases is somebody may tell you this: let me give you some advice. Just go with it. Stop beating your head against the brick wall. And I'm going to tell you this: beat your head against the brick wall. And beat it so often and so hard until a crack forms. And when that crack forms, beat it harder and faster until the crack becomes so big that it can't be ignored and some quality improvement has to take place to fix the flaws in the process. Okay? So don't sit back just so the meeting can be over quicker. That again leads to mediocrity. It leads to average. It leads to a state of I'm just getting paid. And that's really why I work, is to get paid. Not in this profession. You need to understand that you have the opportunity to work in what I consider the most visceral field, being healthcare, to where patients are putting their trust in your hands to take care of them, to make decisions for them, and to make the best possible decisions in their course of care that leads to positive outcomes, which is ultimately, hopefully, them transitioning home, or in some cases, transitioning to the next phase of life, whatever it may be. But it's not just to be average, okay? Now, those are 3 examples that I gave you. Bad advice. I want to give you one piece of, probably the best piece of advice I ever received when it comes to working as a respiratory therapist. I was in a room. The patient was not doing well. I find myself in the room looking at the mechanical ventilator, looking at the monitors, looking at all these numbers and processing them, and just staring at the machine and the monitors. And over my shoulder was, again, a veteran respiratory therapist. Actually, this respiratory therapist is actually my catecholamine when it comes to the respiratory therapist I always wanted to be. And when I say catecholamine, I mean he was the base model for how I wanted to be as a respiratory therapist. He approached his entire day with calmness. He was always collected and had a tendency and a way with patients that I had never seen before. His name is Tim May. Tim, if you happen to see this video or somebody relates back to you, I appreciate your presence in my life as a young respiratory therapist. But I was standing there looking at these monitors, staring at the machines, and he very quietly over my shoulder says, "Joe, always look at your patient more than you're looking at your machines and your monitors. You're not here to treat the monitor or the machine. You're here to treat your patient." That was the single most sound piece of advice I'd ever received. That was the beginning of my patient first mindset that I adopted as I was finding my way as a respiratory therapist, to remind myself and to always remember that when you walk into a room, you're not taking care of the machine. You're not just trying to get that pulse ox to say 93. You're trying to fix the patient. So spend more time looking at and interacting with the patient than you do looking at and interacting with the machines at the bedside. Okay? Now, tying this all back together. Bad advice. How do you know it's bad advice? Well, just from my experiences and from the examples I gave you in this video just over the last few minutes, the pattern that I see that seems to predicate bad advice is when somebody starts it off with, "Let me give you some advice." It seems like that anytime somebody starts off with saying that, "Let me give you some advice," it usually follows with advice that is either asking you to accept mediocrity, to just be average, to stop asking questions, and to stop your pursuit of perfection, which is just a perfection doesn't even exist. So we talk about perfection. It doesn't even exist, but you should always be in a pursuit of perfection, to perfect your art, to perfect yourself as a respiratory therapist in doing the very, very best for your patients. So I just wanted to share this with you today. You're going to get lots of advice along the way. Be able to tell the difference between advice that is helping you become a better respiratory therapist or advice that is helping you become an average therapist. Okay? Now, speaking of advice, I want to leave you with this. This channel is yours. Comments, questions, whatever you want to see, share it, come back, tell me what you want from me, okay? And I'll be glad to give it to you. My goal here is ultimately to improve the level of patient care that's happening around the world at the level of respiratory therapy. And I address these to future respiratory therapists because, like I've said before, you are the future. You are the culture to be. And each of you go out with a desire to be great and a desire to pursue knowledge with compassion and kindness, and you all together collectively from around the world, not just here in Texas where we're based out or where I'm based out of, but around the world. If the level of respiratory care out of the future respiratory therapist goes up, then ultimately total patient care goes up. It's all about the patient. That's where it starts.